Hi, I'm Gabi,
I'm Katrina.
and we'll be doing the lab practical.
So excited. I hope you guys enjoy this. Please like and subscribe down below. Hit that follow button and let's get into it. All right, so we're gonna be doing the calcaneofibular ligament, and first you're gonna locate the lateral malleolus, and then going straight down towards the calcaneus is where that ligament will run through.
All right, so we're gonna find the lateral femoral epicondyle. So by doing this, you can put your fingers in the joint space, and then you can move laterally and medially. But to find the lateral one, you can move laterally and then move up until you find the bump, and that's the lateral femoral epicondyle.
All right, so now we're gonna find the greater trochanter. So what I'm gonna have you do is pop a hip for me. There we go. And then you're gonna feel that prominent bump, which is gonna be right here. Hip, hip, hooray.
Okay, so this is for the pes anserine. What you're gonna do is you're gonna find the tibial tuberosity, which is right here. You can put your pip joint on it and then go 45 degrees medially, and it would be a burst, so that would swell up, but you can't really palpate it. It's just there.
Okay, so now we're gonna find the fibular head. So what you're gonna do is you're gonna go in the joint space, you're gonna move laterally and inferiorly until you feel a prominent bump again.
All right, so we're gonna find the inferior tib-fib joint, and so we can do this by starting at the malleoli and working medially until you drop into a groove, and this is superior to the talocrural joint.
All right, so now we're gonna find the adductor tubercle. So what you're gonna do is you're gonna find the joint space, and then you're gonna be moving medially, and then you're gonna move superior until you feel a bony structure. And this is gonna be in the inferior aspect of the medial femoral epicondyle.
All right, so this is the deltoid complex. It's a very widened and thick group of ligaments, and there's 4 of them, and it's inferior to the malleolus and just surrounds it.
Okay, now we're gonna do the navicular tubercle. So here you're gonna see the malleolus, and then you're gonna move down inferiorly about 45 degrees until you feel a prominent bump. And these ones are the most common tarsals on the medial side of the foot.
All right, so here we're gonna find the MCL, and to do this, you're gonna find the joint space, and then you're gonna move medially until you're forced out of it, and you should be on the MCL ligament right here, and this will prevent valgus movement.
All right, so now we're gonna look at the triangular subcutaneous area. So you're gonna go superior to the malleolus until you feel the bone, and then right above that is muscle. So you wanna stay in that bone area.
Okay, so now we're gonna find the peroneus brevis insertion, and to do this, you're gonna find the styloid process, which is the base of the 5th metatarsal, and it's right there.
All right, so now we're gonna get into the dermatomes. We have stroke, deep touch, and pinprick. So we're gonna start with L2. It's gonna move inward and anterior to the thigh. Close your eyes. Does this feel the same? Does this feel the same?
Yep.
Does this feel the same?
Yep.
All right, so now we're gonna be doing L4 dermatome. So I'm gonna have you close your eyes. First, we're gonna be doing anterior knee. Does this feel the same?
Yes.
Okay, then we're gonna do superior tib fib. Does this feel the same?
Yes.
Okay, then we're gonna do medial malleolus. Does this feel the same?
Yes.
Okay, then we're gonna do inner big toe. Does this feel the same?
Yes.
Okay. Does this feel the same?
Yes.
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 Okay, does this feel the same?
Yes.
Does this feel the same?
Yes.
All right, does this feel the same?
Yes.
Does this feel the same?
Yes.
All right, so now we're gonna do L5. Close your eyes for me. Okay, we're gonna do the lateral thigh. Does this feel the same?
Yep.
We're gonna do lateral calf. Does this feel the same?
Yep.
Lateral malleolus. Does this feel the same?
Yep.
And then lateral dorsal of foot. Does this feel the same?
Yep.
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 And then does this feel the same?
Mhm.
Does this feel the same?
Yep.
Does this feel the same?
Yep.
Does this feel the same?
Yep.
Does this feel the same? Cool.
Okay, so here we're gonna do dermatome S1, and so this is gonna be lateral posterior thigh. So does this feel the same?
Mm-hmm.
And then move to the lateral gastroc head. Does this feel the same?
Yep.
And then you move to the lateral longitudinal arch. Does this feel the same?
Yep.
All right, and then you go deep pressure. Does this feel the same?
Yep.
Does this feel the same?
Yep.
Does this feel the same?
Yep.
All right, and then pinprick. Does this feel the same?
Yep.
All right, does this feel the same?
Yep.
Does this feel the same?
Yep.
All right. Oh. Now we're gonna do S2 dermatome. So we're gonna start with medial posterior thigh. So does this feel the same?
Mm-hmm.
And then then go to the posterior gastric head medially. Does this feel the same?
Yep.
And then stay away from the medial malleolus and go straight to the medial longitudinal arch. Does this feel the same?
Yep.
Okay, and then go to deep touch. Does this feel the same?
Yep.
Does this feel the same?
Yep.
Does this feel the same?
Mhm.
All right, and then pinprick. Does this feel the same?
Yep.
All right, does this feel the same?
Yep.
Does this feel the same?
Okay, so now we're gonna be moving on to the myotomes. We're gonna be doing L1 and L2, which is hip flexion. So you're gonna raise up your knee, up, hold it, good. Same with the other side, up, hold it, good. Now we're gonna be moving on to L4, which is dorsiflexion. We're gonna be moving the toes upward. All right, up, hold it, good. Same with the other side, up, hold it, good.
Okay, so now we're gonna test the S1 myotome, and for this you're gonna start in dorsiflexion and inversion, and then I'm gonna resist you, and you're gonna push down and out. Good, now here, hold, good. And then move to the other leg, and start up and in, and then move down and out. Good, now hold, good. Now we're gonna test the S2 myotome, and this is gonna be knee flexion, so you're gonna support, and then you're gonna kick your leg up. Good, now bring it down a little bit. Hold, now don't let me push you down. Good, now other one. You're gonna kick up. Good, bring down. Don't let me push. Good. All right, so here we're gonna be doing the ankle anterior drawer sign, and this is gonna be testing the ATFL, the anterior talofibular ligament, which prevents displacement of the talus off the fibula. So here you're gonna stabilize the tibia, and you're just gonna anteriorly draw the ankle. And if the ATFL was sprained or anything, you would see some movement. And then now we're gonna do the other side too. So stabilize the tibia and just.
Okay, so now we're gonna do the Lockman's test. This is gonna test for the ACL. So what I'm gonna do is I'm gonna create an open pack position with the knee, so it's like flexion. I'm gonna stabilize the femur and the tibia, and I'm going to anteriorly translate the tibia, like so, and you should feel like there's a closed point, unlike if it was torn, then it would kinda keep going. There wouldn't be a fixed end. And then you would do the same with the other side. You have to completely relax. As you can see, it's not torn.
All right, so this is gonna be the Trendelenburg test, and so I'm gonna find the top of the iliac crest, and you're gonna lift your one leg up, and then, all right, lift the other leg up now. So you see how the iliac crest stayed level. In a positive test, you would see the iliac crest drop when the leg is lifted.
It's like a dance move. Okay, so now we're gonna be doing Apley's compression. This is gonna test for meniscus. All right, so what I'm gonna do is bring up their leg to a 90-degree angle, and then I'm gonna push down and rotate this way and rotate externally as well, so internally and externally. And then if they complain with signs of pain from this, then that's when we would look into further for meniscus injuries.
Okay, so this is the neuroma test, and what this is an inflamed nerve sheath on the 3rd and 4th metatarsal. So squeezing these metatarsals together would cause more pain for the patient, and so to relieve this pain, you can push the base of the head of the metatarsal in on the 3rd and 4th, and this should relieve the pressure and the constriction of the nerve sheath.
All right, so now we're doing manual muscle testing. This one is gonna be against gravity, and it's rated on a scale from 0 to 5. So first one we're gonna do is gluteus maximus. So the patient is gonna be prone. They're gonna lift up their leg to a 90-degree angle, and then first they're gonna lift up their thigh. So lift it up, good. Back down, then with some resistance, up, good, back down, and then up, and then hold it. Up halfway, hold it, good. We're gonna do the same on the other side. Okay, so lift this up. All right, up, good, okay. And then now with some pressure, up, yep, and then up again, and then hold it, nice. Okay, so then we're gonna be doing the semi-tendon, can you help me here? Tendinosis, thank you. Okay, so this one's gonna be for here. All right, so first we're gonna do full range of motion, good. And then you're gonna bring this up, some resistance, good, back down, hold it, hold it, hold it, hold it, good.
Okay, same with the other side. All right, full range of motion. Good. All right, with some resistance, up. Good, back down, hold it, hold it, hold it, hold it. Good. Okay, so now we're gonna test the S1 myotome, and for this you're gonna start in dorsiflexion and inversion, and then I'm gonna resist you, and you're gonna push down and out. Good, now here, hold, good. And then move to the other leg, and start up and in, and then move down and out. Good, now hold, good. Okay, here we're gonna test the Achilles reflex, which is your S1 reflex. So you're gonna take the flat side of the hammer and you're gonna find the Achilles tendon back here, and you're gonna look for a downward type movement. So there it is. So you can see the movement downward when I hit it. And then we'll go to this side too, and we'll do this side. Okay, so now we're going to be testing the peripheral nerves, and so first we're going to do the superficial perineal, which is part of the lateral compartment, and what we're going to do is, you can close your eyes, we're going to stroke the lateral distal 1/3 of the tibia, so does this feel the same?
Yes.
And then we're going to go into eversion, so your foot's going to move outward, so move outward, good, move outward, good.
All right, for our last peripheral nerves, we're gonna be doing the superior gluteal. So we're gonna be stroking on the hip, close your eyes, okay? And then we're gonna lift this up, nice, okay? Flip over. We're gonna do the same on the other side. You're gonna bend this knee, right? Move your hip a little bit more forward, align, move back, move your shoulders back, good. Okay, so close your eyes, okay? And then this is gonna come up. Nice. Okay, and then the other one we're gonna do is the femoral. So I'm gonna have you scoot up. Okay, close your eyes. All right, it's gonna be on the anterior thigh. Nice, and then we're gonna go into knee extension. So come up. Nice, and then same with the other side, up. And that's it.